I am Dr. Frederick Lemley. I work here at Syracuse Orthopedic Specialist, and I primarily take care of foot and ankle patients. I grew up on Long Island, New York in Miller Place, and went to high school there. I went to college at Dartmouth College in New Hampshire. From there I did med school here in Syracuse at Upstate Medical, and from there I went to West Virginia for an orthopedic surgery residency, and then I did a foot and ankle fellowship in Columbus, Ohio. And that ended in 2006, and I've been practicing here in Syracuse ever since. I treat primarily foot and ankle patients, and my treatment philosophy basically comes down to doing the right thing for each patient. So, you know, one patient may have the same problem as another, but the treatment strategies would be different based on their expectations, their lifestyle, their age, their ambulatory status. So that means we can treat people both operatively and non-operatively. It took a long time for me to decide to be a physician. I went to college not sure what I wanted to do, with options open. Towards the end of college, I decided that medical school would be the thing to do. I did not have a role model, a parent, or someone who was a doc, and so it's kind of a later decision in my college career. I had no idea what I wanted to be at that point in terms of what area of medicine. I initially wanted to be a primary care doctor because my neighbor was a primary care doctor and my doctor, and I thought he was a very good guy and did a great job for me and my family, so that was my initial thought. But as time went on, I decided I wanted to do something more surgical, and so slowly it became evident that I was going to be an orthopedic surgeon. I chose a foot and ankle fellowship for a couple of reasons. One is foot and ankle surgery is difficult and challenging. I thought I was up for the challenge to try to make people better from that perspective. And so that was one of the impetuses, one of the reasons I went into foot and ankle, was because I thought it was a challenge, and there is some significant reward for helping difficult patients with difficult problems. Furthermore, in foot and ankle, you get to do a little bit of everything. You know, you can do sports style stuff with arthroscopy. You can do joint replacement stuff, as we talked about with total ankle replacement. There's pediatric surgeries as well. So you get kind of the whole gamut, and you get to do a lot of different things surgically. So it's always a challenge and always something new to entertain yourself with or keep you interested. And that was one of the reasons I chose a foot and ankle fellowship. What makes me most proud of my work is really doing the right thing for the patient. There are a lot of extraneous factors that tend to influence people, but I think what makes me most proud is I really try to figure out what is the best for that patient. And kind of what I said before, you know, what might be right for one patient isn't right for another. So you can't treat everybody just as a textbook where you know, follow the instructions and do it. You have to kind of figure out based on what the patient is and who the patient is and what their expectations are. So there are a lot of factors, and I think that's the hardest part about being a doctor, is making sure you treat each patient the right way. The greatest reward is great patient outcomes. When you do something for a patient and they're very happy, that's by far the best. I have one patient who comes to mind who had a broken tibia that had been fixed elsewhere and it never healed, and his plate broke and he had miserable pain, and we put him through a pretty big surgery to correct that, and you know, it worked out great, and he's back to life and he thinks it's awesome, and he, you know, sings my praises whenever I come in. That's the best reward as a surgeon, and you know, also, you know, consequently, when you do something and it doesn't go as well as you hope, that's the worst part. So most of what I do outside of orthopedics primarily is related to the family. So I have 2 children, Jack and Ava, so I spend a lot of time hanging out with them. Sometimes not doing a lot of fun stuff like homework, but trying to get outside and do some fun things with them. Also, my brother's in the area, so I get to hang out with him and his family. We like what everybody likes, you know, SU sports and doing stuff like that. The best part about Syracuse is the stuff you take for granted. You don't have traffic. You don't have to deal with Long Island traffic and drive in an hour and a half to do your job. So that's one thing I enjoy that flies under the radar. Schools are good. My family's, we're safe. It's a safe community, and people are generally pretty nice, and it's and the lifestyle is fine. So I enjoy Syracuse for that. I chose SOS in 2006. I had finished my fellowship in foot and ankle, and I had a lot of exposure here in Syracuse because I'd gone to med school here and knew I'd enjoy the area and had a good 4 years here previously. In addition, there was a good job, and it seemed like a good job at the time, and SOS was a good group. One of the things that I think is best about foot and ankle services here at SOS is that we have a broad spectrum. So you can see me as a surgeon, and we also have podiatric arms that specializes in some non-operative management of foot and ankle problems, including toenail problems and skin problems and stuff like that. And we do a good job trying to service the patient in that most patients don't even need a surgery, and we have a SOS shop in which we carry all manner of shoes, orthotics, braces and stuff, because many people who come across me in the office don't need a surgery and they just need to be optimized with the right shoe or the right orthotic, or meeting our podorthist who specializes in that. So we have people who are dedicated to that, so you don't just see me or my partners in the office. I have a whole team that works to make everything better, from people who help you with shoes and dedicated shoe folks, and we have a person named Maureen who does a great job, who's a podorthist whose job and specialty is taking care of hard to fit feet. So she does that. We can make braces and custom braces and all sorts of things right out of SOS. So the beauty of it is you can come to see us here in the office, and we can direct you both operatively and non-operatively, and pretty much you can take care of all of this right at SOS for the most part. And I think that is really great for patients in that you can kind of do one-stop shopping, and you don't have to be carted or travel all over Syracuse looking for the right shoe and the right thing.